This person performed a medical procedure in the state of Georgia without being licensed.
A former Albuquerque salon owner is now facing 24 felony charges over so-called vampire facials.
Horror stories in New Mexico, Georgia, California, and Florida, ranging from laser hair removal resulting in severe burns to fatal celeb lookalike procedures.
We're concerned that when the patient goes in the door, do they know the difference? Do they know that some of these procedures can be harmful if not operated by qualified people, etc.?
Lyle Kelsey hopes to prevent that harm from ever reaching the Sooner State. As the lead of the Oklahoma Medical Board, he's pushing for updated guidance for medical spas or med spas that the group oversees. Define a med spa for me.
Well, it's hard to.
We visited Advanced Aesthetics, a med spa in our area, to find out.
Scooch down for me.
They tell us the procedures they perform are purely cosmetic. According to their website, their team has performed more than 250,000 procedures. Lindsay Willie works there as an injector.
Probably the top three that I see patients for are going to be the neuromodulators.
And they're injected into the small muscles of your forehead, for instance, or between your eyes. And what that does is it paralyzes them.
Botox and Dysport.
Lip fillers, and we see a lot of that in this clinic.
Injectables, so fillers, Sculptra.
Laser hair removal, very common. We're able to do it in our clinic on all skin types, from the lightest to the darkest.
Dr. Michael Elder is an anesthesiologist. He's owned this med spa for nearly 3 decades and serves as the medical director.
Well, it's amazing to me, really, that technology has grown, and really, for the most part, is very, very safe. But you need to know what you're doing.
What brings you in today? I started in December of 2009, and I've been here ever since. Okay, we can do that.
Lindsay, a licensed professional, says the job goes beyond injecting and lasering.
Very good. I mean, to stay up with everything happening in aesthetics, you really can't not train. It's gonna take effect over the next 2 weeks.
At least once a week, she continues her education.
There's a lot of anatomy and interaction between muscles or different things happening under the skin that we have to take into account when we are doing those injections.
The state's medical board less concerned about people like Lindsay or Dr. Elder. They tell me they want to crack down on those performing without a license.
We've all heard of the issue of buyer beware on anything that we purchase as consumers. We have to put some effort into it ourselves to find out, are these people trustworthy? Are they experienced? Are they trained?
The state medical board has jurisdiction over more than a dozen professions, including medical doctors and physician's assistants. The rules right now approved back in 2008, and it allows people who are not licensed in these areas but have training to perform beauty procedures in Oklahoma. They must be performing the work under someone who's licensed before, during, and after treatment, though. Has there been any kind of complaint filed with the state of Oklahoma Medical Board when it comes to either licensed or unlicensed?
Yes, we have gotten complaints. I can't go into specific detail, you understand, but yes, we've gotten complaints by people that have been under their concern as far as being harmed.
Kelsey says most med spas in Oklahoma are doing things the right way. This updated mandate would simply require more transparency for patients.
You're talking about their credentials, you're talking about their experience, how many cases have they done, as well as being ready to handle emergencies if and when they happen.
In the meantime, he suggests doing your research.
The patient needs to take some responsibility to call the nursing board, to call the medical board on PAs and MDs, call the osteopathic board on DOs, find out who these individuals are that have their names and hopefully their license and certificates up on the wall. What are they walking into in this med spa, and who's providing the service?
The Oklahoma Medical Board says that they plan to have a draft of the new regulations by the end of this month.